Hi, my name is Tony Shaboon, and I am going to do an assessment of a newborn baby. Okay, so the supplies I have is a thermometer, tape measure, there's gloves here, there's hand sanitizer, I have my stethoscope, there's alcohol, and I have a pen light here. And so I am going to start the assessment. So I'm going to walk in, I'm going to provide privacy. I am going to clean my hands or wash my hands, and I'm going to introduce myself. Hi, my name is Tony. I'm going to be your nurse today, and I am going to do an assessment on the baby. Mom, can you please tell me your name and date of birth? Can you please tell me baby's name and date of birth? Okay, and then I am going to check both of their wristbands to make sure that they match. And so they both match, everything is fine. Okay, so we're gonna start with the background. So this is baby CB. She's female, of African American descent, born 2 days ago on September 5th at 0300. Baby was a full-term baby at 39 weeks gestation, vaginal delivery with no complications. We are currently in room 100 with mom and dad. Dad is present on the phone. Mom is a 26-year-old African American female, gravida 1, para 1, and she's currently holding the baby. She was currently holding the baby and bonding with the baby. The baby is quiet, in flex position and alert. Upon walking in, mom was breastfeeding the baby. Baby had good root, good sucking and swallowing, as well as good gag reflexes. Mom stated that baby had her first void in meconium 24 hours ago, and the baby's meconium was normal. It was black and sticky, which is normal for newborns. The baby is 3,500 grams in weight, which is normal. Anything above 4,000 grams will be considered large for gestational age. Anything below 2,500 would be considered small for gestational age. So the baby's weight is fine. Baby was 50 centimeters in length, which is normal. Anything between 46 centimeters to 56 centimeters is within the normal range for newborn babies. So we are going to take the baby's temperature. Baby's temperature is 97.9, which is normal. The normal for newborn babies is 97 degrees Fahrenheit to 100.3 degrees Fahrenheit. And so we are going to start the assessment. So I'm going to put on some gloves and clean my stethoscope. Mom is currently holding the baby. The baby is wrapped in a blanket. Mom has given me the baby, and the baby is wrapped in a blanket. We want to make sure we maintain thermal regulation because babies can lose heat from 4 different mechanisms, which is radiation, conduction, convection, and evaporation. So we want to make sure that we can keep the baby warm. So I'm going to clean my stethoscope just to make sure that everything is clean for the baby before using it. All right. So I'm going to first start by getting the head circumference of the baby. All right, baby's head circumference is 35 centimeters, which is normal for newborn babies. The normal would normally be half of the baby's length plus an additional 10 centimeters. So 35 centimeters for this baby's head circumference is normal. All right, so we are going to look at and keep the baby warm. We're going to start with the baby's head first. Baby's hairline is normal. There's some light hair with no infestation. The baby's coronal and sagittal sutures are present. They are firm and flat, and the baby's anterior and posterior fontanelles are present, and they're normal. They're not protruding, and there is no molding or kaput. If there was a kaput, the sutures will be crossing, and a hematoma will be centralized. Now we're going to look down at the baby's ears. The ears are symmetrical, and the pinna has good recoil after folding, and each ear has an external ear meatus. Now we're going to look at the face. The face is symmetrical. The face is symmetric. It's not asymmetric. And there's no lesions, no bruises, no swelling. The eyebrows, the eyelashes, and the hair don't have any infestation. The eyes are less than 3 centimeters apart, which is normal for newborn babies. The eyes are not protruding. There's no swelling or edema. The sclera is white, which is normal, and not yellow for jaundice. And there's no discharge coming from the eyes. The skin, there's some milia on the cheeks, the nose, and the chin, which is normal and will subside in a couple of months. The nose is midline, and no protrusions, no swelling. There's no discharge coming from the nose. We're going to look inside both nares. Okay, both nares look good. There's no coloanal atresia in the nasal area, and the nose looks good. The lips are symmetrical. They're pink and moist. No cracks, no lesions. There's no cleft lip, and we're gonna look inside. The mucous membranes are pink and moist. The tongue is midline, and it is not protruding. We're going to take our finger, we're going to feel inside. So inside is no cleft palate, which is normal. Let me come back to the eyes. I want to make sure that all right, the pupils are equal, round, and reactive to light and accommodation. So now we are going to put the baby down because we want to look at the baby's neck. So the baby's neck is midline. Baby's able to flex her head left to right. There's no webbing and no swelling or edema on the neck. We're going to go down to the chest area. We're going to look at the clavicles. Palpating the clavicles, there's no crepitus, no edema. The nipples are protruding, and the breast palates are palpable, and the clavicles have no breaks or fractures, which could happen during pregnancy due to shoulder dystocia. And the baby has full range of motion in both arms. All right. So now we are going to listen to the apical pulse. So I want to make sure that I warm up the stethoscope to make sure we don't have any heat loss from the baby due to the stethoscope being too cold. All right, we're going to go down to the fourth mid-clavicular, fourth intercostal space, and listen to the apex of the heart. The apex of the heart for 1 full minute, and it is at at 152 beats per minute, which is normal. The normal for newborn babies is 110 to 160 beats per minute. So now we're going to listen to the lung sounds. We're going to start with the right apex. We're going to go across to the left apex. We're going to go down to the left mid oxillary. We're going to go across to the right mid oxillary. We're going to go down to the right lower lobe and down to the left lower lobe. Okay, no adventitious sounds were heard. All lung sounds were clear. And now we are going to turn the baby over because we want to listen to the posterior lungs. So same thing, we're going to start with the right. We're going to go over to the left. We're going to go down to the left mid oxillary, right mid oxillary, right lower lobe, left lower lobe. We are going to, now that we're here, we're going to listen. We're going to see, look at the baby's spine. There's no hair tuft. There's no Mongolian spot. And the gluteal creases are normal and equal. And the anal is noted and located. There's some laguna present on the scan, but everything looks normal. Now we are going to look at the abdomen. So baby's abdomen is round and soft, and the baby's umbilical cord, there's an umbilical stump here. It has 2 arteries and 1 vein, and it is currently yellow and shiny, which is normal for newborn babies. And now we are going to listen to the baby's sounds, abdomen sounds. All right, so same thing. We want to make sure that it is warm before we use it. So we are going to start with the right lower quadrant. We're going to go up to the right upper quadrant, across to the left upper quadrant, and down to the left lower quadrant. And we're going to listen for high-pitched sounds. High-pitched gurgling sounds were heard in all quadrants, and normal. So now we are going to look at the baby's extremities. The baby is able to flex both extremities. So we're going to flex the legs for the ortolani and the Barlow. Baby is able to flex legs and has no hip dysplasia. Baby has 10 fingers and 10 toes. The plantar grasp reflex is present, and baby has no simian crease in the hand. We're going to look at the brachial pulses. The brachial pulses are present at 149 beats per minute. We're going to feel down for the femoral pulses at 147 beats per minute, which is also within the normal range. And now we are going to look at the baby's genital area. So for female, the labia majora covers the labia minora and the clitoris, and there's no discharge, which is normal for females. If this were a male, we would be looking at the meatus. The meatus should be midline, and if it were a epispatus or hypospatus, we would report it to the doctor. We would also want to look to see if the testes are distended, and if they are not, then we will also report that to the doctor. All right. So Oh, I'm sorry. So we're gonna do that. Now I'm gonna change my gloves because I want to check on the startle reflexes for the baby. So I am going to check 4 different reflexes: the Moro, the tonic, and the galant, and the Babinski's reflex. So first, with the Mora, you want to pick the baby up, and you kind of want to pull the baby's head back lower than the body, and the baby's hands will flare out. So the baby's hands did flare out once I lowered his head, which is normal for the Mora reflex. The next is going to be the tonic reflex, where we're going to turn the baby to the side, and we're going to turn the baby to the right side, and the right arm and the right leg will flex, while the left arm and the left leg is normal. We're going to turn the baby to the opposite side. Same thing. Each side is each one that flexes, and the other will be kind of loose. And so baby has tonic reflex. And now we are going to do the galant reflex, where we are going to turn the baby on her back. We're going to move our hand on the side of each spine, and whichever side we feel is the side that the baby will kind of move to. So if it's the left side or the right side, the left side or the right side, the baby will flex more to that area. And the last thing is the Babinski reflex, where we're going to look at the bottom of the baby's foot, and we're going to pull our finger across the toes, and the baby's toes should fan out. So again, Babinski and Babinski, baby's toes did flare out, and we're also going to check the plantar grasp reflex, where the baby will grasp the fingers, which she currently did. We're going to listen to the femoral the brachial and the femoral pulses, which were normal and within range. And we're going to wrap the baby back up and give the baby back to mom. All right, I am going to take off my gloves. I am going to wash my hands, and I am going to clean my stethoscope one more time. And that ends my assessment.